SpanTech LLC 2018 Open Enrollment. SpanTech is pleased to announce that we partnered with Assured Partners, a team of dedicated, experienced insurance professionals that will manage your employee benefit package. The Assured Partners office is located in 1945 Scottsville Road, Suite 100 in Bowling Green, behind Rafferty's. Your dedicated service team are Josh Smith, Benefit Advisor, Lisa Lee, Senior Strategic Account Executive, Cassie Alsip, Account Manager, and Sue Lofton, Member Service Level AE. Who do I contact if I need assistance with a claim or benefit inquiry? Should you need assistance with a claim, have a question regarding your explanation of benefits, or have a benefit question in general, please feel free to contact Sue Lofton, Member Service AE, direct at 270-393-6208 or by email at sue.lofton@assuredpartners.com. Please note that the following slides were designed to provide you with a brief overview of your 2018 benefit package. In the event of a conflict between the carrier summary and this description, the terms of the carrier summary will prevail. In this presentation, we will review the following: benefit basics, medical benefits, health savings account, dental and vision insurance, employer paid and voluntary life, employer paid short-term and long-term disability, and voluntary cancer. You and your eligible family members may apply for benefits if you work at least 30 hours per week. Your benefits are effective immediately on your full-time date of hire. Coverage is also available for your spouse and your dependent children through age 26. Please check each benefit plan for dependent age and eligibility rules. You and your eligible dependents must be enrolled within 30 days of becoming eligible. Your elections for the plan year will remain in effect for the full year unless you experience a qualifying life event. If you experience a qualifying life event as listed below, you may change or cancel your coverage during the plan year to meet your needs. You must notify the Human Resource Department within 30 days of the event date to ensure that there's no disruption of your coverage. Sample qualifying events include birth, adoption, and legal guardianship, divorce or legal separation, marriage, death of policyholder, turning age 26 and aging off of a parent's plan, loss of Medicaid, FMLA-related leave, or loss of employer-sponsored group coverage. For a complete list of qualifying events, please contact your Human Resource Department. Medical benefits. SpanTech is pleased to announce that effective October the 1st, 2018, we have partnered with Cypress Benefit Administrators to manage your medical benefits. The SpanTech medical plan will move to a partially self-funded platform, meaning that all claims up to $35,000 per insured member will be funded or paid for by SpanTech. If an insured has an approved claim in excess of $35,000, a stop-loss carrier will fund the difference. Cypress Benefit Administrators will manage your medical plan and will adjudicate claims, paying the provider, and managing plan costs. The pharmacy vendor will be TrueRx Management Services. TrueRx assists by eliminating prescription drug markups, which results in you paying the lowest possible cost. The TrueRx Patient Assistance Program will also assist members with treatment and drug therapy information and can often assist in finding additional rebates or discounts that are associated with high-cost specialty drugs. There are two medical benefits in which you may choose from. You have a buy-up PPO plan, which offers first dollar immediate copays, and a high-deductible health plan, which is called the Core Plan. It is HSA compliant, and there are no copays associated with that plan. The PPO plan has a $500 single deductible. Again, you have immediate copays. If you were to go to your primary care physician, it's a $25 copay. specialty care physician is a $50 copay. You have a $75 immediate urgent care center copay, and then you also have immediate copays for prescription drugs. Tier 1, typically generic, is $10. Tier 2, brand, $30. Tier 3 is typically non-brand, $60. And Tier 4 is the higher cost specialty drugs, which is 25%. Specialty drugs are commonly the drugs that you see flash across your TV screen. These are the drugs that the pharmaceutical reps are going into your provider's office and providing them samples of. Oftentimes, your provider will write you a specialty drug prescription when in all actual, they may prescribe 2 of the generic or brand drugs that have the same ingredients as that specialty drug and will save you a whole lot of money. So what we want to encourage you to do in order to save you money is to request a generic when the generic is available. Sometimes the difference in drugs will be acceptable by the patient. Other times they will not work. A specialty drug may have to be provided at the pharmacy. So again, check with your provider just to see if any other combination of drugs will work, again, just to save you money. You also have a mail order, a 90-day mail order that you can utilize as well. The core plan is a high deductible health plan. It is, again, associated with a health savings account, so you get a lot of tax advantages there. It does not offer you first dollar copays. Everything is subject to your $3,000 deductible. Once you hit your $3,000 deductible, the carrier will pay 80%. Your responsibility is 20%. If you had a really bad year, the most you will be out of pocket on the high deductible health plan is $5,000 for single, at which time the carrier will pay at 100% for the remainder of that calendar year. If you had a really bad year and you're enrolled in the PPO plan, the maximum out-of-pocket for single coverage is $4,100. Again, that's the maximum you will be responsible if you had a really bad claims year before the carrier would pick up at 100% for the remainder of that calendar year. Please note that both of these plans offer preventative care in-network, which will cover certain things, immunizations, well women checkup, well child checkup, so forth. We're going to get that on the following slide. It's covered at 100% on both plans. If you enroll in the high deductible health plan, SpanTech will make quarterly contributions towards your health savings account. Please note that if you're enrolled in the Anthem plan currently, your current deductible and out-of-pocket maximums will roll over to the new carrier. It will take approximately 60 to 90 days for this information to appear on your explanation of benefits. Pricing for the PPO plan. Again, the PPO plan is the richest plan. It offers immediate copays, and it also has that $500 deductible. It's going to cost you the most. For single coverage, it's $125.17. And of course, you get further reductions based on your activity into the wellness program. Fasting blood sugar is listed below, blood pressure, BMI test, LDL cholesterol, non-tobacco usage. You also have pricing reflected there for coverage for your spouse and dependent children. The high deductible health plan is the $3,000 deductible plan. It does not have immediate copays, but it is tied to a HSA bank account. The pricing for the high deductible health plan is $67.04 per paycheck. And again, you get further reductions based on your wellness activity. Spouse and dependent children pricing is listed as well. If you rarely go to the doctor or take prescription drugs, you may want to consider enrolling into the high deductible health plan. If you enroll in the PPO plan and you're never utilizing that services, it's a lot more out of your paycheck that you will never get back. You basically are throwing money out of the window. You can invest the difference from the $67 to the $125.17 into an HSA bank account that is yours. You'll never lose the money, and it gives you so many tax advantages. We're going to get to those slides in the next few minutes. Preventative care. On the medical slide, I mentioned that preventative care and network is covered at 100%. That includes immunizations, well women checkup, well child checkup, mammograms, blood pressure tests, cholesterol tests, and more. Even tobacco cessation products. If you're trying to kick the nicotine habit, you can get the first 180-day supply at no cost to you. After the 180-day supply, it will be subject to your Tier 1, Tier 2, Tier 3, Tier 4 copay structure, or to the retail price if you're enrolled in the high deductible health plan. This includes select generic prescription drugs that will be patches, gum, and the drugs itself. So certainly take advantage of this. Note that for preventative, your provider has to bill the claim as preventative to the carrier. So a lot of times when people go in and to see their physician, they also mention how they've had this awful cough and their knee is hurt and their back is hurt. And if the doctor has to look into other things, that may not be filed as a preventative test. It may turn into a sickness where you will owe towards your deductible, depending on what test you perform, or your copays may be subject to copays at that time. So what we suggest is that when you go and you schedule your preventative meeting, your consult, is that you limit it to the preventative care so that the provider does file accordingly. And if you ever receive an explanation of benefit that just doesn't look right and you need our assistance to look into, we most certainly will be happy to do so. Just reach out to Sue Lofton in our office. Things to know about your PPO plan. Again, with a PPO plan, you have immediate first dollar copays for office visits, urgent care visits, prescription drugs. The copayments do not apply towards your deductible, but they do apply to that out-of-pocket maximum. Dependent children are covered through age 26, regardless of your full-time studentship or marital status. Your network now is www.centercare.com. We encourage you to log on, make sure that your provider participates in the network. If you are a Wisconsin resident, your new network is Triology, www.triologycares.com. Again, please check your provider. Anytime you go to out-of-network providers, they can balance bill you for whatever they want to, and you pretty much have to pay the bill. These providers have already contracted with this network, and they will write off any differences and not balance bill you. One thing to note for CenterCare Network, which is the Kentucky residents, is that you may go to any of the medical center locations, Medical Center Bowling Green, Medical Center Scottsville, Franklin, Caverna. However, Greenview Hospital is not a participating provider. The physicians are, and you just need to request that, anytime you need to go to the hospital, that they send you to the Medical Center of Bowling Green, Scottsville, Franklin, Caverna. Non-emergent use of the emergency room. In every medical plan document, there's language called prudent person lay law, and it states that if you go to the emergency room for a non-emergent situation, carriers can and will deny your claims. We're seeing carriers do so. If your claim is denied, you have the right to appeal, but we're seeing a lot of appeals being denied as well. So what that means to you is that you could be responsible for your entire emergency room bill if it's denied. So we want to encourage you to seek the emergency room treatment for true emergencies only. If the condition is non-emergent, we want to remind you to seek care from your primary care provider or urgent care clinic. Things to know about your high deductible health plan. Your deductible and coinsurance applies to your out-of-pocket limit. Of course, there's no copays that apply. Dependent children, again, are covered through age 26, regardless of full-time studentship or marital status. Now, if you enroll in the high deductible health plan, SpanTech will make a quarterly contribution towards your HSA bank account. Contributions are determined based on your medical election, and we're going to review that contribution schedule in the upcoming slides. Again, the same network. If you're a Kentucky resident, please log on to centercare.com to make sure that your provider participates in the network. Again, the exclusion locally here is Greenview Hospital is not part of that network. The network for Wisconsin residents is Triology, the triologycares.com. Please log on to your network there to make sure that your provider is part of that network. Again, the prudent person lay law language exists in every plan document. Again, if you seek emergency room treatment for true emergencies, but if it's non-emergent, please try to seek care from your primary care provider, urgent care clinic, so that you're not billed for the entire portion of that bill. What are emergency room visits used for? Life or limb threatening, such as severe chest pain, seizures, sudden paralysis, uncontrolled bleeding, head injuries. Some of the non-life threatening situations are ear, eye infections, mild fevers, sore throats, allergies, pink eye, cold symptoms, flu-like symptoms, allergies. Those are the things that, if you can possibly utilize your urgent care primary care physician for, it's going to save you more money. Health savings account. A health savings account, also known as an HSA account, is a unique tax advantage account that can be used to pay for your current or future health care expenses. It's owned by you. It's not like a flexible spending account. The HSA funds roll over and accumulate year after year if the money is not spent, and it has the ability to earn tax-free interest. HSA funds can be used to pay for qualified medical expenses such as deductibles, co-insurance, prescription drugs, dental, vision care, long-term care, nursing home, and much more at any time without a federal tax liability. If you enroll in the high deductible health plan, SpanTech will provide the following quarterly contribution into your very own HSA bank account through Optum Bank. Employer contributions are based on your high deductible health plan medical enrollment election. If you enroll for single coverage into the high deductible health plan, SpanTech will provide you with a $125 quarterly contribution to your very own HSA bank account. If you elect to enroll your employee, your spouse, your children, your family coverage into the high deductible health plan, SpanTech will provide you with a $250 quarterly contribution into your HSA bank account through Optum Bank. Who is eligible for an HSA account? Any individual that's covered by a high deductible health plan on the first day of the month, is not covered by any other health insurance, including a flexible spending account or HRA, is not enrolled in Medicare, and who cannot be claimed as a dependent on someone else's tax returns. Are my HSA contributions 100% taxable for my gross income? Yes, they are. Can I be enrolled in the PPO plan and have an HSA bank account? No. You must be enrolled in a high deductible health plan. Now let's see, if you enroll in a high deductible health plan this year, and let's say next open enrollment you decide to go with a PPO plan, but you have $3,000 in your HSA bank account. That's fine. That money is still there for you to use at any time. However, if you're enrolled in a PPO plan at that time, you cannot continue to make contributions into your HSA bank account. You can only make contributions into an HSA bank account when you're enrolled in a high deductible health plan. If I don't use the funds in my HSA account, do I lose them? No, absolutely not. Unused funds roll over year to year. Again, however, you have to be enrolled in a high deductible health plan to be able to continue to contribute towards your HSA bank account. What is the maximum contribution for 2018? It's $3,450 for single coverage and $6,900 for family coverage. Now, again, take into account the employer contribution. If you're going to max this out, you'll have to minus out the employer contribution. How do I enroll in this benefit? You'll automatically have an HSA bank account open for you when you enroll in the high deductible health plan. Now, if you wish to contribute towards your HSA bank account, you'll need to indicate the amount that you wish to have payroll deducted into the Benesolve enrollment system. Simple qualified expenses. You may use your HSA debit card for acupuncture, alcoholism treatment, artificial teeth, crutches, doctor's office visits, drug addiction. It even has long-term care services that are limited, physical therapy, eyeglasses, vision exams, hearing aids, insulin, speech therapy. There's a whole list. You can even go into the IRS.gov and provide a much more detailed list than this. For 2019, the IRS contribution limits will increase slightly to $3,500 single and $7,000 per family. Dental benefits. The dental insurance is through Health Resources, also known as HRI. There are no deductibles. When you go and you have a diagnostic or preventative exam, such as teeth cleaning or x-rays, you should leave the provider's office paying nothing. It should be covered at 100%. If you were to get fillings, that's covered at 80%. Your responsibility is 20%. And any other service such as root canal, simple extractions, athletic mouth guards, emergency treatment, that's covered at 50%. It has a $1,000 plan annual maximum per insured person. It resets every year. And it also provides a $1,000 dependent lifetime ortho benefit. Dependent children are covered through age 26. And again, you want to make sure that your provider participates in network by visiting insuringsmiles.com, find a dentist. SpanTech provides full-time employees with voluntary dental insurance and even a greater contribution this year than last year. The employee pricing is $3.24 per pay period for single coverage. Employee plus one dependent, that could be a spouse or a dependent child, is $6.75 per pay period. And family coverage is $11.54 per pay period. Vision benefits. Vision benefits are through United Healthcare. You have a $10 vision exam copay and a materials copay of $25. You get an exam once every 12 months, new pair of lenses once every 12 months, and a new pair of frames every 24 months. The frames allowance is $130 retail, and then you also have an allowance for contact lenses or lenses for your glasses. The vision rates are $2.94 per single coverage, $6.53 per employee spouse, $5.57 for employee children, and $9.19 for family. And again, that's per paycheck. You want to make sure that your provider is an in-network provider by visiting myuhcvision.com. Dependent children, again, are covered through age 26. Life and disability. SpanTech provides all full-time employees with basic life and accidental death insurance. It's 100% paid by the company. You will receive 1 times your annual salary to a $50,000 maximum. It also includes an accelerated death benefit. If you're diagnosed with a terminal illness with less than 12 months of life expectancy, you may be eligible for an advancement of 75% of your term life benefit. This is subject to underwriting review and approval. This benefit is important because a lot of times when you do know that you will have a terminal illness, a lot of people want to have their affairs in order. They want to pay things off, perhaps plan their funeral. It's a benefit that's baked into both your employer paid and your voluntary life benefit. The benefit amount will start reducing at age 70. Now, all coverage for employer paid life will terminate at retirement. Voluntary life will also be through One America. You're eligible to apply for voluntary life at this open enrollment. Employees are eligible for 5 times annual base salary up to $300,000 maximum. However, at this open enrollment only, you can apply up to $100,000 without health questions if you're under the age of 70. This is an awesome opportunity for those of you who may be otherwise considered uninsurable due to your height, your weight, your current medical condition. Again, you cannot be turned down at this one-time open enrollment if you were to apply up to $100,000 guarantee issue. Any amount above $100,000 will require health questions and will be subject to underwriting review and approval. Spouses are eligible to apply for up to 100% of the benefit that you take out to $100,000 maximum. The guarantee issue at this one-time open enrollment event is $30,000. That means that you'd have to have a minimum of $30,000 on you if you wish to take advantage of this. Again, this is very important for spouses who may be otherwise uninsurable in the marketplace. You can, at this one-time open enrollment, insure your spouse for $30,000. Coverage on spouses will terminate at age 70. Dependent children are covered from live birth to 6 months for $1,000 and 6 months to age 26 for $10,000. The guarantee issue is $10,000. Benefits start reducing at age 70 by 35%. and additional at 75, 80, and 85. The accelerated death benefit is also included in this. This also means that if you're diagnosed with a terminal illness with less than 12 months of life expectancy, you may be eligible for an advancement of 75% of your term life benefit. Sample pricing per pay period for $50,000 if your age is 20 to 29 is $2.08 per paycheck. Age 30 to 34 is $2.77. 35 to 39 is $3.46. And age 40 to 44 is $5.31. Very, very affordable. If you apply for the One America Voluntary Life Benefit, a $10,000 minimum, you and your dependents are eligible to apply for the accidental death and dismemberment. It's a very affordable coverage. Now, it will only pay as a result of a loss or condition related to an accidental death or dismemberment. Sample pricing for the accidental death for $100,000 is $1.38 per pay period. What this means is if you were to take out $100,000 in voluntary life and you were to die by sickness, your beneficiary would receive $100,000. However, if you had an accidental death benefit for $100,000 and you were to die by accident, your beneficiary would receive $200,000. So you're eligible to apply for the accidental death up to $300,000 at this open enrollment, and this is not subject to any health questions. Again, the caveat is the loss will have to occur due to an accident-related situation. At the 2018 open enrollment or as a new hire, you may elect voluntary life up to the guarantee issue limit regardless of your health. This is a great opportunity for anyone who currently has an illness that would otherwise keep you from being approved for additional life insurance. What do I do? What happens if I do not elect additional voluntary life during this open enrollment? Should you decline the coverage during this open enrollment or your initial enrollment event and wish to apply for voluntary life coverage at a future open enrollment date, you will have to answer health questions, and your application health history will be subject to a One America underwriter approval. So you could be issued the coverage or you could be declined. Please also note that if you take out a minimum of $10,000 on the voluntary life, next year at open enrollment, you will be able to increase by another $10,000 without any health questions, as long as you do not exceed the policy maximums of $300,000. Short-term disability. SpanTech provides all full-time employees with employer-paid short-term disability coverage through One America. It pays you 66 2/3% of your weekly salary should a covered accident or sickness disability occur. The short-term disability benefit helps protect your income and lifestyle if you're not able to work due to an off-the-job accident or sickness. Benefits start on day 8 for accident and sickness. SpanTech provides all full-time employees with employer-paid long-term disability coverage through One America as well. This benefit pays you 60% of your monthly income should a covered accident or sickness disability occur. The maximum benefit duration is Social Security full retirement age, and a 312 pre-X clause will apply. Pre-X 312. Benefits will not be paid if the person's disability begins the first 12 months following the effective date of the person's coverage and the person's disability is caused by or contributed to the result of a condition, whether or not that condition is diagnosed or misdiagnosed, for which the person received medical treatment, consultation, care, services, including diagnostic measures, or was prescribed prescription drugs or medicines in 3 months prior to the person's individual effective date of insurance. Now, if it's a non-related disability that occurs that you've not been treated for 3 months prior to your effective date, then there's no pre-existing clause to worry about. Also, if you're currently enrolled in the Mutual of Omaha long-term disability, the pre-X language is waived. You are also eligible for an EAP program, also known as an Employee Assistance Program through One America. This program offers you confidential counseling for stress, anxiety, depression, problems with children, job pressures, grief, loss, substance abuse. This is all confidential counseling that goes straight to ComPsych. SpanTech will not have any information regarding your consultative call. Everything is highly confidential. You also have financial information and resources, legal support and resources, work-life solutions. You can also have a free online will preparation. During this enrollment, we're going to capture your beneficiary information, and if you don't have a will prepared, you really want to take care of going on to that free online will preparation site and preparing one. We discourage you from leaving your estate to, or your life insurance proceeds to a minor under the age of 19 without a guardian being appointed. So certainly try to have a will prepared, or at least appoint a guardian as your beneficiary. Travel assistance program is also offered through One America. This also includes medical monitoring. You may go on vacation and need emergency cash, or have to have a vehicle return, or you may have to have travel companion assistance should an emergency arise and you have a medical emergency. You may lose your eyeglasses or your prescription drugs. This program is wonderful to assist in those ways, so please make sure that you write the phone number down, contact information, and certainly take advantage of it if you need it while traveling. Allstate benefits. This is a cancer policy provided by Allstate. What makes this policy unique is the ICU air ambulance payout. Cancer policies by nature are all competitive with one another. You're going to have daily payouts for hospital confinement. You're going to have private duty nursing care, chemo, radiation, ambulatory second opinions, initial diagnosis. All of that's going to be competitive by nature. All that's going to be paid to you should you have a cancer claim. It also includes a $100 wellness benefit per covered person. It includes a 1212 pre-X language, but what makes this really unique is that it has an ICU air ambulance benefit baked in. What we hear from a lot of employees is that they come to us with bills from air evac services, where whether or not they were part of that air evac network, or they were called in by another, they were transported to a hospital from another air evac unit that they're not a member of, they were left with an invoice. Many of the invoices I've seen are over $30,000, and the air evacuation company is not really willing to work with those people. This benefit that's baked into the cancer policy, as long as you are admitted into an ICU unit from your air ambulance transport, it's going to pay your entire actual charges to the hospital, whether you have air ambulance, ground ambulance, as well as ICU payouts for whatever reason. So whether a sickness occurs, whether it's cancer related, whether you're traveling and you have an automobile accident and they call an air flight to lift you to the nearest hospital for emergency treatment, as long as you're admitted in the ICU benefit, it's going to cover your entire bill regardless of what network is used. So this is why we're promoting this benefit, because you will not find that benefit baked into on any other policies. There is a 1212 pre-X. If you're already enrolled in this benefit, that's wonderful. Just re-enroll in it when you enroll in the BeneSolve system. There's no pre-X to worry about. If you're enrolling for the first time, there is a 1212 pre-X, and what that means is that you've had symptoms for cancer within the last 12-month period prior to the effective date of coverage, or you've sought medical advice or treatment, or is receiving treatment for the medical profession within 12-month period prior to the effective date, there is an initial 12-month exclusion for that particular cancer. Now, if it's a new condition, a new cancer that's been diagnosed after the effective date that you've not been treated for or taken medication for or didn't have symptoms for, then there's no pre-X to worry about. If you're applying for the first time at this 2018 open enrollment, you will have to answer health questions by completing an evidence of health form. Your application will be subject to review and acceptance or declination by the Allstate underwriting team. As a reminder, this is your annual open enrollment. You must keep all elected benefits in place until the 2019 annual open enrollment unless you have a qualifying life event. And with a qualifying life event, remember that you only have 30 days from the date of event to submit your paperwork to Human Resource. There is no exception to that rule. How do I enroll? New users will log on to mybenesolve.com and you'll set up a registration. You'll verify your first name, your last name. You'll list your company identifier as SpanTech. You'll list your last 4 digits of your social and your birth date. From there, the Benesolve system will prompt you to make your benefit elections. You'll start with your medical, and then it will ask you if you want to enroll in, if you enrolled in the high deductible health plan. It'll show that you're eligible for the HSA bank account and so forth. Summary of benefits and coverage is available for you as well. It's just an overview of your current medical benefits. It will be posted on the employer portal at Benesolve, or you may request a copy by contacting your Human Resource Department. We thank you for attending the SpanTech 2018 Open Enrollment presentation.